Millions of women are turning to hormone tests and supplements, but doctors say many of them may not need any testing at all. And with new guidance on hormone therapy making headlines, there's a lot of confusion out there.
Yeah, this morning we have 9 News health expert Dr. Powell Coley joining us to break down what's real, what's risky, and what every woman should actually be paying attention to. Dr. Coley, good morning.
Good morning. What a fad this is, right?
Oh my gosh. Yes.
We've been hearing everything online, as you can imagine, on social media. People all have kinds of different opinions. Why is it so important for doctors to really nail down all hormonal imbalances?
If you think about what our hormones do, guys, there are over 50 different hormones in our body, and they all interact with each other. So if our thyroid hormone is down, it can affect our sex hormones, our energy, our hair loss, our weight gain. And so it's really hard for us to nail down exactly what the problem is. On top of that, hormones can vary during the day. So when we wake up in the morning, what happens? Our cortisol levels go up to help us feel more awake, to help us get through the day, and then they're supposed to go down at night. So if you test it at the wrong time of the day, you could get a completely different answer and think that you have an hormonal imbalance when actually it's just normal variation of your hormones.
Interesting. All right, so which hormones are affected as we age?
So what do you think?
I would guess like
testosterone, estrogen.
Yeah,
so that's a big one, right? Our reproductive hormones.
Yeah.
And that goes down for men and women. That's a ton of hormones actually that go down as we age. But as early as our 20s, 30s, and 40s, we start to have decline in our sex hormones. So women lose estrogen, progesterone, and even testosterone starts to go down in women. Men lose testosterone starting in their 30s, about 1% per year. They have a decline in their testosterone levels. That's something that's called menopause or andropause. You may have heard of that. Our growth hormone starts to go down as we age. So we lose muscle mass and we start to accumulate fat. This is called somatopause. And this can also start as early as our 20s. Our thyroid starts to get a little bit lazy, so our thyroid hormones can start to decline as we age. And then as we get older, we're more likely to become pre-diabetic because our insulin sensitivity also tends to go down. Melatonin tends to go down, so our sleep gets disrupted. So part of the normal aging is that these hormones go down as we age. And yet we think somehow that this is pathological, something that needs to be fixed.
Well, then, by that account, should all of us at some point need to go in and get our hormones checked?
Absolutely not. And that's what I want to drive home today. So the way that we think about hormone testing for young people is really driven by symptoms. So if you're a young person that's having abnormal symptoms, like, you're starting to, for example, as a woman have abnormal bleeding, or you're having some change in your menstrual cycle under the age of 40, 100% we need to check your hormones because that's abnormal. It could also be a sign of premature menopause, which we know increases heart disease and dementia and other types of risks. But if you're a woman in your 40s having those types of symptoms, that's normal. And in fact, what we say to these women is if it looks like a duck and sounds like a duck and walks like a duck, it's a duck. So checking the hormones can actually mislead us because they could be normal. The hormones aren't necessarily reflective of the symptoms because the hormones haven't completely settled out. Now, on the other hand, if you're older, we do screen for some hormone deficiencies. For example, after the age of 50, we start to look at your thyroid hormone because most of us develop a little bit of hypothyroidism.
All right, what are the warning signs that a woman should get her reproductive hormones checked? I mean, I hear about perimenopause like literally all the time.
And I have patients come into my office, Corey, and they say, oh, can you check my hormones? Because I think all my symptoms are because of perimenopause. So I would say if you're under the age of 40 and having any types of irregular periods, that's a sign you need to get your hormones checked. If you're having infertility, for sure, you need to get your hormones checked as well. And if you're somebody who's had any kind of chemotherapy or anything like that, you probably need to get your hormones checked because all of that can be affected by those medications.
All right, learning a lot this morning. Dr. Coley, thank you so much for being here.